Hello, I am Dr. Marco Palma. In my more than 20 years as a neurologist and internist, I have treated thousands of patients and have seen, believe me, practically everything. I have celebrated recoveries that seemed impossible and have stood by families in their most difficult moments. And all this experience, all these years on the front lines of healthcare, has taught me something that is almost never said out loud. Sometimes the wisest medicine is knowing when, simply to do nothing. Today I will share something very personal with you, something that goes against what many think and will surely surprise you. I will reveal the 5 routine medical checkups that I, personally, would never do after the age of 60. Never. And I do not say this out of whim or negligence. I say this with the weight of over 20 years of evidence, having seen the consequences of a medicine that, at times, in its obsession to find everything, ends up doing more harm than good. These tests, which are sold to us as the latest innovation in prevention, can put us in a spiral of anxiety, invasive procedures, and complications that take away what we value most in our golden years: independence and quality of life. So, if you are over 60, or if your parents or grandparents are approaching this age, stay with me. Not only will I tell you which tests to avoid, but I will explain why with real stories from my patients and with scientific data that leaves no room for doubt. And the most important thing is that I will give you alternatives, the safest, smartest, and sometimes simplest strategies to truly take care of your health, to live longer, and above all, to live better. It's not about being afraid of doctors. It's about being an informed patient who takes the reins. Let's get started. The first test on my list is, perhaps the most enticing of all, the full body screening. You see it advertised in executive clinics, promising a head-to-toe review with the latest technology in MRIs or CT scans. Sounds incredible, right? A complete picture of your insides to discover anything before it causes problems. It's the promise of total control. But the reality, my friends, is very different and often dangerous. Let me tell you the story of Roberto, one of my patients, 68 years old, a man full of life. He played golf, traveled with his wife, enjoyed his grandchildren. He was healthy, without a single symptom. One day, his son, with the best intentions in the world, gifted him an executive checkup for his birthday, which included one of these full screenings. Roberto went, more to please his son than anything else. And there, right there, his problems began. The scanner report arrived with a note that chilled the blood. A small indeterminate lesion of 1.5 centimeters is observed in the left kidney. Lesion. Indeterminate. 2 words that are a bomb of anxiety. From one night to the next, Roberto went from being a healthy man to being a patient with a lesion on his kidney. His doctor, as per protocol, referred him to a urologist. The urologist, to be safe, recommended a biopsy. A kidney biopsy is no joke. It involves inserting a long needle through the back into the kidney. It has risks: bleeding, infection, pain. Roberto, brave, agreed. The result took a week. A week that he and his family lived in a state of total panic. And the final verdict? Angiomyolipoma, a benign tumor, completely harmless, made of fat, muscle, and blood vessels that would never cause the slightest problem. Roberto earned nothing. On the contrary, he lost. He lost his peace. He underwent an invasive and risky procedure and caused great distress to his family. His case is not the exception. Sadly, it is what happens more often than you think. And here is the scientific data that changes everything. Studies show that up to 86% of healthy adults who get a full body scan find something. 86%. The vast majority of these somethings, like Roberto's, are what we call incidentalomas. Accidental findings, benign, unimportant, spots on the liver, cysts in the kidneys, nodules in the lungs, scars of time that have been there for years and will never become a problem. The real problem is that once you find something, what we call the intervention cascade gets activated. The incidentaloma creates anxiety. Anxiety leads to more tests. Tests can be invasive and may have their own risks, and everything can end up in totally unnecessary treatments or surgeries. This avalanche starts with a test that should have never been done. Moreover, if the scanner is a CT scan, we are talking about a considerable dose of radiation that can be equivalent to hundreds of chest X-rays. Radiation accumulates, and even though the risk of a single scan is low, it is not zero. Why take this risk without a clear benefit? So, what is the smart alternative? The answer is not in a machine, but in something much more human: comprehensive geriatric assessment. This is not just a simple checkup. It is an in-depth conversation with a doctor who understands how we are aging. Instead of chasing ghosts, we focus on what truly matters for quality of life: function. In this assessment, the first thing we do is a frailty check. It is not an insult, it is a vital medical concept. We measure simple things like walking speed or grip strength. These markers predict future health much better than any imaging. If we identify early frailty, we can act with exercise and nutrition to reverse it. Then, and this is crucial, we conduct a thorough review of medications. It is incredibly common to see adults taking 10 or more pills prescribed by different specialists. Many times, symptoms like dizziness or confusion are not a new illness, but a side effect of one of these pills. Reducing this list can work wonders. And finally, let's evaluate lifestyle habits: diet, sleep, physical activity, and social connection. These are the true pillars of prevention. An anti-inflammatory diet and regular exercise prevent more diseases than any scan. This assessment does not create anxiety, it empowers you. It does not seek theoretical problems, it optimizes your actual health. So, the next time you see an ad promising a map of your health, remember Roberto and choose the wisdom of a person-centered assessment, not an image. The second check I avoid like the plague is the routine brain MRI for mild forgetfulness. It's the daily bread in my practice. A patient aged 65 or 70 is often brought in by their children because they forget the names of actors or can't remember where they put their glasses. The typical forgetfulness of age. They are not lost, they are not disoriented, they manage their money perfectly. But the fear of Alzheimer's is so great that the family requests an MRI to see what's going on in there. I want you to understand this. Asking for an MRI in this situation is, almost always, a terrible idea. It's opening a Pandora's box from which only anxiety emerges. Let me introduce you to Marta, 72 years old, a brilliant woman, a voracious reader who started to notice that sometimes it was hard for her to find the exact word. Her daughter, very worried, convinced her to get an MRI. The day she read the report, Marta's world collapsed. The radiologist described mild diffuse cortical atrophy, typical of age, and scattered foci of gliosis in the white matter. For a doctor, this report is essentially a description of a normal 72-year-old brain. It's like saying that a person of this age has wrinkles or gray hair. Atrophy is a slight reduction in normal brain volume over time. The white matter lesions are like small scars that form, usually due to blood pressure that has been a bit high for decades. They are expected findings, but for Marta and her daughter, it sounded like a death sentence. Cerebral atrophy, lesions. They left there convinced that Alzheimer's was imminent. Since that day, Marta has changed. She started to doubt herself. She left her book club for fear of not remembering a name. The MRI did not give her a diagnosis. It stole her confidence in her own mind. And here comes the bombshell. In studies with completely healthy people over 70 years old, 94% of brain scans show abnormal results. Almost all of them. If we scan 100 healthy people of this age, 94 will come out with a report that may seem alarming. The problem is that these images do not correlate well with the person's actual function. I've seen patients with scans that looked like a battlefield and a very sharp mind, and vice versa. The image is not the person. And what's worse, the result of the scan does not change anything in the treatment for mild forgetfulness. There is no pill that reverses age-related atrophy. So, what is the sensible alternative? The most valid tool is a simple 10-minute cognitive test in the office. Tests like the mini-cog or the MOCA. We ask the patient to remember 3 words and to draw a clock. It's simple, quick, and gives us very valid functional information. If the test is normal, we can reassure the family with a high degree of certainty. If it shows some difficulties, then we don't stop there. We start what I call the hunt for the false culprits of memory problems. Before thinking about Alzheimer's, we rule out a list of common and especially reversible causes. Medication review. Again, the main suspect. Sleeping pills, anxiety medications, some antihistamines can cause mental fog. Blood tests. We check vitamin B12 and thyroid function. Their deficiency or hypothyroidism are classic and easily correctable causes. Mood assessment. Depression in older adults often manifests with apathy and memory problems. Treating it is a very underrated cause of cognitive issues. Only after ruling all this out, if functional tests show a progressive decline, then imaging may make sense as part of a comprehensive study. The message is clear. In the face of minor forgetfulness, don't rush to the MRI machine. Go to a doctor who sits down to talk with you, who assesses your actual function, and who looks for reversible causes. Before continuing, I want to get to know you better. What is your main health concern after 60? Write it in the comments. If maintaining independence and quality of life is still important to you, subscribe to Dr. Marco Palma's channel and turn on notifications. And if you find this video helpful, write the number 1. If not, write the number 0. The third check on my blacklist is the routine cardiac stress test. I'm referring to putting a person over 65 who feels well, with no chest pain or shortness of breath, to run on a treadmill just because they're already at that age. This practice, still very common, is fraught with problems and can be dangerous. Javier's story illustrates this very clearly. At 68 years old, active, playing tennis and walking every day, 0 cardiac symptoms. He needed to have surgery for a hernia, and the hospital protocol included a stress test for everyone over 65. Javier didn't understand it. If he could play a 2-hour match, why did he need to run on a machine? But protocol is protocol. During the test, Javier began to feel pressure in his chest. The electrocardiogram showed questionable changes. The cardiologist stopped the test and, faced with a questionable positive result, recommended the next step, a cardiac catheterization. A catheterization is invasive. A tube is inserted through an artery to the heart to view the coronary arteries. Javier, who had walked in for a simple test, was now being wheeled in for a cardiac procedure. The result? His arteries had a bit of cholesterol, normal for his age. Blockages of 30 to 40% that required neither stents nor surgery. What happened? Javier had a false positive. The treadmill stress test has a very high rate of false positives in older adults. It can yield an abnormal result for 1,000 reasons that are not a dangerous blockage, but the damage was already done. Javier was labeled a heart patient. He was prescribed a lot of pills and, worst of all, he was made afraid of exertion. He quit tennis. The test that was supposed to protect him robbed him of his quality of life, and not to mention that the test itself can, in rare cases, cause an arrhythmia or a heart attack. So, what is the logical alternative? First and foremost, listen to our body. The best stress test is daily life. If you can climb 2 flights of stairs or walk briskly without chest pain, you are already passing the stress test every day. It is crucial to learn to recognize real warning signs, chest pain with exertion, disproportionate shortness of breath, palpitations. If any of this appears, consult a doctor. There, yes, a test is indicated. Now, if we want to assess future risk, there is a much more modern and safe tool, the coronary calcium score. It is a simple low-radiation, non-invasive CT scan that lasts 5 minutes. It measures the amount of calcium, hardened cholesterol, on the walls of the arteries. The result is a number. A 0 means a very low risk of heart attack in the coming years. A high number tells us that we need to take prevention seriously. The calcium score tells us what our risk is, not whether an artery is blocked. It is a tool to guide prevention, not to trigger invasive procedures. My advice is, don't let them put you on a treadmill as a routine. Trust your body, and if you want to refine the risk assessment, ask for the calcium score. We have reached the 4th examination, and this is probably the most controversial because the colonoscopy is a fantastic tool, but its usefulness depends on age. The examination I will not undergo is the routine colonoscopy after 75-80 years if my previous exams have been normal, and I do not have a special risk. Let it be clear, I am not against colonoscopy. I undoubtedly recommend it starting at 45-50 years old. It prevents colon cancer by allowing us to remove polyps before they become malignant. The problem arises when we apply this logic to people of very advanced age. In medicine, one must always weigh the benefit against the risk, and in an 80-year-old, the scale tips toward risk. Let me tell you the case of Elena, 76 years old. Her last colonoscopy at 65 was normal. Her doctor's computer system reminded her that it was time for another one. Elena had no symptoms, but she was obedient. The preparation for the exam was torture. Liters of a laxative kept her in the bathroom all night, leaving her weak and dehydrated. For someone her age, this is a serious risk. Then there's sedation, which in adults has more risks of confusion or respiratory problems. But the risk that keeps doctors up at night is intestinal perforation. With age, the wall of the colon becomes thinner. The risk of an accident with the endoscope, although low, 1 or 2 in every 1,000, doubles or triples in those over 75 years old. And a perforation is an emergency that requires major surgery, often with a colostomy, a bag. For an 80-year-old, such an operation can be the end of their independence. Now, what is the benefit? Preventing a cancer that, if it were to appear, would take 5 to 10 years to cause problems. Major medical guidelines already recommend stopping routine screening between the ages of 75 and 85. The logic is simple. It is more likely that a colonoscopy will hurt you rather than save you from future cancer if your life expectancy is less than 10 years. Of course, this does not apply to everyone. If there is a family history, previous polyps, inflammatory bowel diseases, etc., the decision is different. But for the average person, continuing to have them routinely is an unnecessary risk. So, what do? Do we forget about colonoscopy? Not at all. We move from invasive screening to smart surveillance. First, symptom surveillance. This is vital. You must consult immediately if there is a persistent change in bowel habits, blood in the stool, abdominal pain, unexplained weight loss, or new anemia. In the face of this, age does not matter, and a colonoscopy is justified. Second, and the most powerful, active prevention with diet. The secret to a healthy colon is fiber. Fruits, vegetables, legumes, whole grains. Fiber feeds are good bacteria that produce anti-inflammatory and anti-cancer substances. Eating more lentils, broccoli, oats, or apples is a much safer intervention and benefits the whole body. My message is, get the right colonoscopies at the right time. Up to age 75, it is vital. After that, for most, it's time to focus on symptoms and the power of what we put on our plate. And we come to the fifth and final check. This is for men and is one of the most debated topics. The blood test for prostate-specific antigen, PSA, to detect prostate cancer, especially in adults over 70 years old. PSA has been marketed as the great promise for detecting prostate cancer in time. The problem is that the biology of this cancer, especially in older adults, is very capricious, and the indiscriminate use of PSA has created an epidemic of overdiagnosis and overtreatment. Let me explain the story of Carlos, 77 years old, widowed, independent, and active. During his annual checkup, he was asked for a routine PSA test. It rose to 6.5. A bit high. Carlos felt perfectly fine, but this number was the starting whistle for the cascade. From the family doctor to the urologist, and from the urologist to the prostate biopsy. A prostate biopsy is unpleasant and carries risks, especially of serious infection, sepsis. Carlos was unfortunate. He ended up in the hospital with sepsis. He recovered, but then the biopsy result came back. Prostate adenocarcinoma, Gleason 6. They found cancer in him. But what kind of cancer? A Gleason 6 is the slowest type of prostate cancer there is. It is so slow that many of us doubt whether it should even be called cancer. The likelihood that a 77-year-old man will die from a Gleason 6 is almost zero. He is sure to die with it, but not because of it. In fact, autopsies show that up to 80% of 80-year-old men have cancerous spots in their prostate without being affected by them at all. But Carlos was told he had cancer, and in the face of that word, people want it removed. Despite being offered active surveillance, monitoring without treatment, anxiety did not allow him to do so, and he chose radiation therapy. The treatment was a success, but the price was very high. The radiation caused him permanent urinary incontinence and erectile dysfunction. His social life collapsed. We treated a cancer that would never have killed him, but in the process, we destroyed his quality of life. This is the perfect example of overdiagnosis, finding a cancer that would never have caused problems, and of overtreatment, aggressive therapies for a harmless disease, and PSA is the engine behind all this. PSA can increase for 1,000 reasons: inflammation, infection, or even from riding a bike. For every man saved by PSA, it is estimated that another 50 are diagnosed and treated unnecessarily with permanent sequelae. So, what do? Do we throw PSA in the trash? No. We do something much smarter. We replace automatic screening with a shared and informed decision. The doctor must have an honest conversation with their patient, explaining the pros and cons with clear numbers. And then, the patient decides what is most important to them. The possibility of extending their life a bit in exchange for a very real risk of ruining their quality of life? For those diagnosed with low-risk cancer, the alternative to treatment is active surveillance. It is not doing nothing. It is close monitoring to ensure that the tumor does not become aggressive, and of course focusing on the actual symptoms: difficulty urinating, blood, bone pain. This, yes, requires investigation at any age. And there you have it. The 5 tests that, based on my experience, I would never do after 60, 70 years. The full body scan, a factory of anxiety. The brain MRI for mild forgetfulness that labels you as abnormal for no reason. The routine stress test that has more risk than benefit. the screening colonoscopy after 75 where the scales tip towards danger, and the routine PSA in older men, the king of overdiagnosis. Do you realize the common thread? It's a call for wiser, more personalized, more humane medicine. A medicine that understands that, especially in old age, the goal is not just to live longer, but to live better, with quality, independence, and happiness. True prevention is not a battery of tests searching for ghosts. It's an alliance with your doctor, an assessment centered on your function, and a daily commitment to a healthy lifestyle. My goal is not for you to fear medicine. On the contrary, it is for you to become active protagonists of your health, to ask questions, to understand the reason behind every test, to have the courage to say, "Doctor, do I really need this at my age and in my situation?" Health is not a report without anomalies. Health is being able to play with your grandchildren, enjoy a walk, keep your mind sharp and your spirit alive. And sometimes the most valid and healthy decision we can make is to say no to an unnecessary checkup. My friend, these 5 medical checks that I revealed to you today can make the difference between living with anxiety or living with serenity, between undergoing risky procedures or protecting your independence. Whenever a doctor proposes a test to you, remember, you have the right and the duty to ask, will this test change my treatment? What are the risks? What happens if I don't do it? A good doctor will not be offended. A good doctor will appreciate having an informed and collaborative patient. Today, I want to hear your voice. If what I shared in this video has opened your eyes to smarter and personalized medicine, leave the number 1 in the comments. It will be the signal that we are heading in the right direction. If you think this content has not been useful to you yet, leave the number 0. Your honesty is the most valuable compass that helps me improve every day and provide you with the value you are truly seeking. And don't let this journey end here. Join our big family by clicking on subscribe and, above all, activate the notification bell. Don't keep this knowledge to yourself. Share this video with your parents, your family, or a friend who is about to undergo one of these checkups. Just one click from you today can be the gift that gives someone peace of mind tomorrow. And I have a special reason for you to come back next week. In the next video, I will reveal the 7 foods that seem healthy but are accelerating the aging of your brain. These are foods that you probably eat every day thinking you're doing the right thing, but they are actually causing chronic inflammation and cognitive decline. You won't want to miss it. Remember, your health is not determined by age, but by the informed decisions you make every day. Your body, like your mind, is always ready to be cared for, protected, and respected. I am Dr. Marco Palma. Thank you for listening to me. See you in the next video. Make wise decisions, and may your life be long and full of quality.